right, folks, as we're rolling in, I have a few notes. So I just want to thank you all for joining us and welcome today's Regional Policy Council's Governor's Leadership Award meeting, Leading the Way, Being First, Being the Future. My name's Alicia Coffey, and I'm the Vice President of States Advocacy, and I'll be hosting today's meeting. So before we get started, the important notes. First, this event is being recorded and it will be emailed out to all the registrants about 1 week. Right now, we are not offering CEUs, but if you would like a certificate of attendance, we have a form where you can request one. That'll go out in the follow-up email. I'm also going to encourage you to pop any questions for our speakers into the chat. We'll be collecting them, and as there is time, I'll pass those along to our speakers and address them at the end of each presentation. I also want to draw your attention to our sponsors. Jackie, can you pop that slide up? We just really could not do it without them. So I want to make sure that we're noting that we have a lot of support from AbbVie, Atai Beckley, the Bazooki Group, Bristol Myers Squibb, Compass, Definium, Johnson & Johnson, Neurocrine, Otsuka, Pfizer, Supernus Pharmaceuticals, and Teva. They're generous donors, and we appreciate that they allow us to do this great work. So on to that great work. We have a lot of information to share today, so I'm going to simply jump right in. Because this is our Governor's Leadership Award meeting, we are so excited to honor New York Governor Kathy Hochul. The state of New York has been designated by the Mental Health America report, The State of Mental Health in America, as the #1 state supporting mental health and well-being in the United States. And I'm excited to invite Glenn Libman, the CEO of the Mental Health Association in New York State, to offer remarks.
Thank you, Alicia. Really appreciate it. Good afternoon, everybody. So this is quite an honor because we're very lucky in New York to have a governor like Governor Hochul. I'll say when she first took office, there was an immediate sea change on mental health in New York State. Though previous administrations, mental health never made it to the frontier issue. When she took office, she started right away by saying that mental health is one of the greatest challenges of our lifetime. I always tell the story about there's this tradition in Albany that the first Wednesday of January, the governor introduces their state of the state. One of the other traditions in Albany, unfortunately, is that after the governor introduces the state of the state, mental health is never mentioned or barely mentioned. For those of us who've been around for many years, we scour the state of the state to see if mental health gets mentioned at all, and rarely does it, maybe a sentence or two. When Governor Hochul took office, pages and pages about mental health. It was unbelievable to see. And about 2 weeks after the state of the state, the New York State budget comes out. This is where the rubber meets the road, where her priorities are actually highlighted behind real funding. Incredibly, not only did she add funding to the mental health budget, but she added over $1 billion in new funding a few years ago. All our priority areas were addressed, from housing to ACT teams to critical time intervention teams, to discharges from hospitals, to parity reform, to workforce, suicide prevention, list goes on, school-based mental health services. These were huge priorities to us, and it was a great credit to her, as well as to Dr. Ann Sullivan, our mental health commissioner in New York, who worked with the governor to make all these proposals become reality across New York State. She has also been a champion of youth mental health and held the very first summit in New York State dedicated to youth mental health. She has listened to the voice of young people and has made it her personal business to enhance the lives of all young people across New York State. Much like Mental Health America and our affiliates across New York and the country, she recognizes that prevention services are the key to our future. There are over 1,200 school-based mental health clinics in New York State. Under her leadership, she's introduced in this year's budget a landmark proposal that would provide every 10th grader in New York State the opportunity to take teen mental health first aid, which is peer-to-peer training for youth across the state. This could represent generational change for all New Yorkers and our goal to normalize mental health in New York State and across the country. This is remarkable. I really want to thank Mental Health America for providing me with the opportunity to present her with this advocacy award. We are truly honored to have her as our governor. So, on to the video.
Thank you so much, Glenn.
I want to thank you for honoring me with the Governor's Leadership Award. I am so proud, incredibly proud, to be recognized by America's longest-running national mental health organization. For almost 120 years, you've been on the front lines, reshaping how we think about and treat mental health, even in eras where you've had little support. When I came into office, New York's mental health system was just languishing, forgotten, and I vowed to make a change. I fought to boost mental health funding by over $1 billion and using that for supportive housing for individuals with mental health conditions, adding inpatient beds and a comprehensive emergency psychiatric program, with mobile treatment teams as well, peer-to-peer programs, and school-based mental health clinics. These investments were just the beginning. Last year, New York established new regulations for behavioral health care, standardizing wait times so every New Yorker can access care within 10 business days. And this year, we're ensuring our children have the knowledge and skills they need to become healthy adults, which is why I made a strong commitment to train every 10th grader across the state in mental health first aid. In addition to what we've done for children there, we have laser focused on trying to help them avoid the specter of being trapped by social media algorithms and doing everything we can to protect younger people on social media. That's why I was so proud to enact one of the nation's very first bell-to-bell cell phone bans in schools. And the results have been extraordinary. And I know we've liberated our children, and without a doubt, they will have better mental health outcomes going forward. That's because everything I do as governor is driven by a single priority: to give every New Yorker the opportunity to thrive. And that's why mental health has been such a focus of mine. And I promise to continue fighting for all New Yorkers, but cannot do this without the partnership of organizations like Mental Health America and the Mental Health Association of New York State. Together, we are leading the way, being first, being the future. Thank you again for this incredible honor.
We're so thrilled to be able to honor the governor, and
I want to thank
we're absolutely delighted that she is so focused on upstream solutions, including early intervention and prevention. So a little fun fact, again, with our theme being first, being the future, Governor Hochul also represents another first, as she is the first female governor of New York. So if anybody asks, there's your fun factoid for the day. I'm excited to introduce our next speaker, Mental Health America's own Maddie Reinhart, the Senior Director of Population Health. Maddie is responsible for Mental Health America's mental health screening services. She manages all things data, and she produces the State of Mental Health in America report. This report is a huge project as she tracks down data, ensures accuracy, and uses it to draw conclusions that inform organizational policy priorities, which Mental Health America uses to serve our mission. Thanks so much for joining us today, Maddie. Take it away.
Awesome. Thank you. And good afternoon, everyone. Thank you all for being here today. And just another thank you to my colleague Alicia for putting together such an information-packed meeting. I'm grateful to be a part of it. Again, I'm Maddie Reinert, and today I will be walking through some of the findings from MHA's most recent State of Mental Health in America report and what the data have shown us about the policies that have the greatest impact on state-level mental health outcomes over our last decade plus of creating this report. Okay. So the State of Mental Health in America is an annual report that ranks all 50 states and the District of Columbia on measures of prevalence of mental health conditions and access to care from federal data sources. MHA first created this report in 2014, and initially the main purpose was to better understand the impact of differences in state implementation of the Affordable Care Act and the Mental Health Parity and Addiction Equity Act. But over the past 11 years, we've continued to gather and publish these state rankings with the goal of understanding where existing policies and programs are working and to provide recommendations to states who want to improve outcomes for individuals and families with mental health needs. And over time, we've really seen states utilize this report in things like needs assessments, as background for policy development, and as a driver for additional resource allocation and investments in mental health in their states. This past year, in our 2025 report, we used 17 measures of prevalence of mental health conditions and access to care. Don't worry, I'm not going to go through every single one of them, but I just wanted to show that there are 7 measures for prevalence and 10 measures of access. So we're skewing a bit more toward measuring access to care, and that these measures cover both adult and youth mental health. These measures are all gathered from nationally representative data sets, mostly from federal agencies, including SAMHSA, the CDC, HRSA, and the Department of Education, among others. And one thing that I do always want to note up front is that we are using the most current state and national survey data that's been released by these agencies, and that data is always time delayed. So most of the state level measures we used in the 2025 report are representative of 2 years of combined data from 2022 and 2023. SAMHSA also released some national data from 2024. So wherever we have it, I will reference it. But all of the state rankings are based on that 2022 and 2023 data. Because of that, we won't be seeing the impact of policy changes from 2024 or 2025 reflected in the state level data or rankings. We'll have to wait for future reports to see the impacts of those more recent policy changes. But we have enough data over time now from doing this report to draw conclusions about what works. So here I just have some of our overall national findings. This is really just for you all to see later when you receive this PowerPoint. I won't walk through this either, but I just wanted to highlight a few things that we've seen over the last few years. For adults, we see that the prevalence of mental health conditions did not change significantly from 2021 to 2024. We've remained about the same post-pandemic. There are also still millions of adults and youth in the US who need care for their mental health and can't receive it. So in that 2022 and 2023 combined data, 1 in 4 adults with a mental illness wanted treatment or even sought treatment, but did not receive it. So the top reported reasons for not receiving that care, first was that they wanted to try to handle their mental health on their own, but that was followed by not receiving care because they knew they could not afford it and not knowing how or where to get treatment. So really clear access issues there. We do have a new measure this year. Almost 30% of youth in the US did not receive their annual preventive healthcare visit. And that's significant because those visits are where we know most youth receive early mental health care, including screenings for mental health conditions if they're not receiving them in schools. Where we have seen improvement nationally is in the prevalence of mental health conditions for youth. And we really do want to celebrate that because for many years we had just seen those numbers trending upward. This is the first time in recent years that we've seen any kind of decline. So there were significant decreases in youth with a major depressive episode in the past year and youth experiencing frequent thoughts of suicide. And of course, these rates are still much higher than we would like them to be, but it is showing that the policies and programs that we were implementing to improve youth mental health from 2023 to 2024 were working. For now, state rankings. In this year's report, the top 3 ranked states were New York, ranked number 1, followed by Hawaii and New Jersey. And this meant that these states had the lowest prevalence of mental health conditions and highest access to mental health care when compared to all other states. For New York, this ranking was really driven by low rates of youth with depression and suicidal ideation and high rates of insured adults, which of course is critical for accessing mental health care. And New York and New Jersey have been performing well over time. In last year's report, they were also ranked in those top 5 states. Nevada, Arizona, and Alabama were the bottom three ranked states, with Nevada being ranked last, 51st, meaning they had the highest prevalence of mental health conditions and lowest access to care when compared to all other states. And this was actually the second year in a row that Arizona was ranked 50th and Nevada was ranked 51st. And in contrast to New York, the things that really drove Nevada's ranking down were that the state had one of the highest rates of youth depression and the highest rate of youth who did not receive any preventive care in the past year. So youth services in the state were particularly lacking. We're also able to see some clear geographic trends across the states. So states that had the highest rates of mental health conditions, that prevalence ranking, which you see on the left, were clustered in the West and in the very Northeast, those darkest green states. And many of these states also had the lowest rates of preventive care, which we see as no coincidence. And when we look at access to care on the right, most of the states with highest access are in the Northeast, those lightest green, and 8 of the 13 states with the least access were located in the southern United States. So we're seeing folks in the South and in some of these states in the West with more rural populations continue to face the greatest gaps in access to mental health care. And the disparities between states with the least access and most access are really huge. For instance, nearly 20% of adults in Tennessee, Mississippi, and Texas were uninsured in 2022 and 2023, compared to only 4% in Vermont, Maryland, and Rhode Island. And almost 40% more youth with depression did not receive care in Alabama than in Maine. So again, really large disparities between those ranked in the top and those ranked in the bottom for access. So now that we've been tracking all of this data for over 10 years, what are the policies that we've seen have the largest impacts in mental health outcomes over time? The first and truly clearest policy that we have seen in recent years for improving access to mental health care is Medicaid expansion. We have seen consistently that when a state chose to expand Medicaid, their access to care data and rankings improved significantly. For example, in 2018, Maine and Virginia ranked in 39th and 40th place for adults with any mental illness who were uninsured. But after both states adopted Medicaid expansion in 2019, their rankings improved dramatically. So in this past year's report, Maine has climbed to 10th place and Virginia is now in 23rd. We've also seen consistently over time that 9 of the 10 states that have not expanded Medicaid are ranked in the bottom across all 10 access to care measures. The only non-expansion state that isn't is Wisconsin. And Wisconsin is unique because they don't have a Medicaid coverage gap, even without expansion, because of their state policies to ensure coverage. And that, again, is not a coincidence. These are changes in population level access that we can see are driven by mental health policy changes. Another policy that we've seen make a huge difference both nationally and at the state level is increased investment in 988 and increased access to community-based crisis services. So I'll talk about this a bit more in a moment, but at the same time that we rolled out 988 and invested in reimagining the continuum of crisis care, we did see a national decrease in the suicide rate. It was a slight decrease in 2024, but that is a signal, again, that these things are working. I mentioned this also earlier, but for New York, ranked first in this year's report, the 2 indicators that made the biggest difference were low rates of youth with depression and suicidal ideation, and both New York and New Jersey had very low rates of adult suicidal ideation as well. Both states have really invested in both their continuum of crisis services, but have also invested in our third bullet here, which is upstream preventative supports. So states, when the report comes out, states will often come to us and ask, okay, 7 of these measures are prevalence measures. Access to care is a bit more straightforward for how to impact it with policy, but what are we supposed to do to reduce the prevalence of mental health conditions in our state? And at this point, we know that prevalence is reduced by investing in early intervention, in screening and prevention for mental health conditions, especially among youth. And we also know that these policies can be cost savers over time. So some of the policies that we've really spotlighted have included school-based services, as well as policies that improve the non-medical drivers of health, like things like paid leave, tax credits, and early childhood supports. So I'll dig a little bit deeper into each of these. Every year, because of the evidence that we've seen for Medicaid expansion, we recommend for states who are coming to us asking how to improve their access. If they haven't expanded Medicaid, we always recommend that they really should expand Medicaid because we've seen that clear difference. Obviously, this year, following the passage of the One Big Beautiful Bill Act, our landscape looks very different. But still, from watching those impacts of Medicaid expansion over time, we know what happens for access to mental health care when the expansion population is covered versus when it isn't. So our goal is to keep as many people in that expansion population who are qualified for coverage covered by Medicaid as possible. I'm sure many of you are very familiar. HR 1 included work requirements or community engagement requirements for folks, but individuals with substance use disorders and disabling mental disorders are exempt from those requirements. So states now have to identify data that demonstrate an individual qualifies for an exemption. And my colleague Tim and our affiliates and partners have also been working extremely hard on gathering the data that states can use to do that. And they'll be presenting in a moment. So I'll leave it up to Tim to dive much deeper into this. But overall, we recommend that states utilize as many pieces of information that are available as possible to exempt as many people who are qualified as possible to preserve their Medicaid coverage. Again, because we know the dramatic impacts that that has on expanding access to mental health care. As I mentioned earlier, all three of the top ranked states in last year's report, Hawaii, New Jersey, and New York, invested in community-based crisis alternatives, including mobile crisis teams. They've also made significant investments in the continuum of crisis care. So in 2024 and 2025, New Jersey invested around $30 million in each year to support 988. New York has also made huge investments in 2025, over $60 million for 988 and crisis services. And so we know that state budgets are becoming much more constrained. So I don't want to sit here and tell you to invest more as a blanket statement, but I'm hoping to spotlight some of the investments that we've seen make a difference. And this investment in 988 and crisis care has really made a difference, especially in suicide rate. Also, part of the initial vision with the rollout of 988 is that states would authorize a monthly fee on phone bills to fund the Lifeline and crisis care, similar to how 911 is funded. So that might also be a good funding option moving forward for states looking for ways to continue to fund these services with those constrained state budgets. Investment in upstream. There is a lot of evidence that early identification and intervention and investments upstream not only have long-term positive outcomes for mental health, but save money over time. In New York, there has been significant investment and policy action for youth and school-based mental health services, as we heard from Glenn and Governor Hochul earlier today. New York was one of the first states to pass legislation requiring mental health education in K-12 schools, which we know from research can improve mental health literacy, increase help seeking, which helps again with that early intervention piece, and reduce stigma around mental health. And New York has also invested significantly in school-based health centers and wraparound care for youth. For Nevada, ranked last in this year's report, two of the indicators that drove their ranking the most, again, was a high percentage of youth in the state experiencing depression and a lack of youth preventive care. So 38% of youth in Nevada did not receive any preventive care in the past year. And investing in these school-based services and mental health education can reduce these unmet needs. When we meet people with care where they are, they don't need to know how or where to access care, which is, again, cited as one of the major barriers for accessing care for both youth and adults. It was one of the main reasons why youth and adults, even who wanted care, didn't receive it, is because they didn't know where or how to get it. So these are really worthwhile investments to be meeting, especially youth where they are upstream. I do want to mention workforce, as workforce availability was also a main driver of lower rankings for Alabama and Arizona. It is a little bit more difficult to draw conclusions about workforce from the measure that we use in this report because kind of the best measure we have across the US is very narrowly defined. It doesn't include peer support specialists, for example. So we can only draw as much evidence as we can using this one measure. But that being said, healthcare staff shortages have long been an issue, especially in Alabama. In fact, for as long as I have been working on this report since 2018, Alabama has always been ranked last for workforce, in large part due to low reimbursement for providers. But to give credit, we will have to watch this space for coming reports. Alabama is investing a significant amount of money in FY26 from their rural health fund on workforce. So we'll have to see how much of that contributes to the behavioral health workforce. If that does have any kind of lasting impact, it's possible that we will see at least some improvement from that investment. Same thing for Arizona. The state has made several recent policy changes in 2024 and 2025 to improve the workforce, including investing in grant and scholarship awards for people pursuing behavioral health degrees, which is something that MHA champions. And another one of our priorities, creating career ladder models for people with lived experience, so they can use their experience as behavioral health paraprofessionals into future credentialing. So again, we haven't seen the effects of those more recent policies in this year's report because it's based on 2023 data. So we'll watch to see if those changes improve their rankings moving forward. And finally, I just wanted to raise the importance of continuing mental health data collection. Not necessarily tied to the rankings, but it kind of underlies everything that we're doing here. So since the beginning of last year, many federal agencies have lost staff or announced changes to their operations that have really raised questions about if some of these federal surveys that we use to track changes over time will continue to be collected, or what kinds of data will be included in them. And without data like these, we lack the information needed to direct resources to populations that we can see are at greatest risk, or assess the impact of these policies over time. So while MHA is continuing to advocate for the federal government to continue the collection of nationwide data, we hope you will join us in that advocacy. We're also hoping that states can build the infrastructure to collect more of this mental health surveillance data. And again, I recognize that data collection and analysis are very expensive. And one of the key benefits of federal data collection is that it is uniform across states so that we can compare states to one another. But something very innovative that is happening currently, some states are trying to solve both of those issues by creating these interstate data collaboratives in other health issue spaces. So there may be opportunity to form similar interstate data collaboratives for mental health data, and especially youth mental health data, because there are so few places where it's currently available. And even those surveys that we've relied on are currently at risk. So that's just my plug for data collection in general, which allows us to do all of this work. And with that, I will pause. I know I'm at the end of my time, so I'll see if there are any questions.
Thanks, folks. Please do put your questions in the chat, so that we can leap into the question and answer period for our presenters. And while you folks are synthesizing and putting a question in the chat, I have one for Maddie. I'm very curious about the relationship between healthy young people and then healthy adults and early intervention and prevention. I know that it's really hard to say, like, this policy created this data outcome. I understand it's like unfair to ask you to do that. But thinking about your familiarity over the long term with this data and your wise gut, can you see in states when they really invest in youth mental health, for example, like mental health education in schools, can you see like 5 years later, all of a sudden, youth do better, or maybe even those youth become adults who do better? Is there like is there a tickle that you see around youth intervention and then healthier young people? And what's that time gap between big intervention and potential well-being payoff?
Yeah, I mean, there are a lot of payoffs from earlier intervention for things like mental health, just education in general. So, not even like school-based mental health services, but mental health education. The CDC has found really long-term great outcomes, both for like future mental health concerns, but also in improving things like belongingness, reducing loneliness among youth, even improving academic outcomes, these other things too that we know contribute to better outcomes in adulthood across both physical and mental health. Also, with just early intervention for youth, we're really trying to tackle that duration of untreated mental health concerns or unaddressed mental health concerns. So there is a lot of research that shows the earlier you intervene for someone who's experiencing symptoms of a mental health condition or mental health needs, the better their outcomes are later on. And because we're seeing all these gaps in access around things like I don't know where I'm supposed to go or how I'm supposed to receive care, those really like reaching out to people where they are upstream in schools, in workplaces, in community-based settings, those are really, really important to meeting people early on so that they're not spending a large period of time experiencing mental health concerns without being able to address them. So I don't know. I'm there is a lot of research that people have done to kind of look longitudinally and see, we've met people with services here and we receive these outcomes here. I don't have the years off the top of my head, but we do know that those early interventions work.
Thank you, Maddie. I really appreciate that overview, and that thought, those thoughts about the impact of getting youth services, early. Thank you so much for your work, and I really appreciate your time here today. Folks, we'll make sure that the Mental Health America State of Mental Health report is included in our follow-up email. And if you have questions for Maddie, please put them in the chat. She'll take a peek and answer in the chat if she can. So we're going to shift to our next presentation. And being that this meeting honors governor's leadership, I'm really excited to introduce our next speakers who work together through the National Governors Association Policy Academy's Youth Advisory Council. So today we're going to hear from Jess Kirchner, who serves as a senior policy analyst for the NGA Center for Best Practices, Children and Families Division, where she has supported governors' human services priorities through early childhood education and care. And we're also going to hear from Braley Lee, who's from Tulsa, Oklahoma. Her background is in community health, and she's currently pursuing a Master of Social Work degree. Woo woo. Braley worked closely with young people with lived experience as a youth coordinator with a specific focus on promoting youth and mental health. So first we'll hear from Jess about the Advisory Council, and then we'll hear from Braley about her experience participating. Go ahead, Jess, take it away.
Hi, everyone. Thank you so much for having me join today. It's an honor to be here, joining this conversation, representing the NGA, and then also the work we did last year, 2 years ago. I don't know. I feel like the years are blurring together, as I'm sure many people in this field feel recently. So as Alicia mentioned, I am Jess Kirchner. I'm a senior policy analyst on the Children and Families team here at NGA. I've been here for about 5 years. And we're going to go to the next slide. For some quick context, the National Governors Association has existed since 1908. We were founded by, I think it was Franklin Roosevelt. I believe it was one of the Roosevelts. I'm a little behind on my NGA trivia. But we really serve as a bipartisan hub for governors to share best practices and connect with each other, share their feedback to the feds, but then also share lessons learned amongst their peers. I sit in the Center for Best Practices, which is what we kind of describe as a CRS for state executives. There are several teams in the center, of which Children and Families is one. You can see some of them listed here. And our work really is kind of the heartbeat of policy at the NGA. We helped connect governors' advisors to their peers. We run long-term technical assistance projects like the Policy Academy I'm about to speak about. We also do short-term convenings, ad hoc TA, facilitated meetings. We really just try to be an extra set of hands to governors' advisors that are kind of working through these policy challenges and try to be as open and flexible and adaptable to their priorities as we can. So that's a little bit of the context of where we sit. The Children and Families team covers all things human services up through early childhood education and care. And so it's a pretty broad portfolio. And for the last few years, youth mental health was a really big piece of it and continues to be a big priority for our audience and our work. Let's go to the next slide. So I just want to briefly give a background on how we started this work. I don't have it up on this slide, but we really dove into the space in 2022. I think I have my years right there. When former New Jersey Governor Phil Murphy came on as chair for the NGA. So NGA has two chairs, or a chair and a co-chair. It's a Democrat and Republican, or a Republican and Democrat, and it alternates every year. And through their chairmanship or chairpersonship, the chairs get the ability to leverage the center and NGA staff to support a national initiative. And so in 2022, Governor Phil Murphy engaged NGA to do an initiative on strengthening youth mental health. It was a series of roundtables focused around a pretty broad set of pillars. But the culminating piece that we really had with it is that we published a youth mental health playbook for governors' advisors that is still live on our website now, that contains a lot of information about what states and territories can do with discrete and concrete examples of what's happening to leverage that any governor could pick up on their first day. So we had that policy academy, or not the policy academy, the chairs initiative, which is kind of like one of those showcase momentum building national initiatives. And then we really wanted to translate it to tangible work. We launched a policy academy, which is a long-term technical assistance opportunity. We supported 6 states. We supported Alabama, Virginia, Oklahoma, New Jersey, Kentucky, and Hawaii. In their efforts to strengthen cross-system coordination collaboration. So each of them came in with different priorities and different team composition and different kind of starting lines. And so our role was to really walk alongside them and support them with the project management, connecting them with SMEs, and providing the peer connection they needed to get there to accomplish their goals. Some of the big themes that came out of that work were expansion of school-based behavioral health services or mental health services, and like the barriers of why in states that have exercised that flexibility, why school districts might not necessarily be billing Medicaid for services. And so some of the work we did with a state like Kentucky was to help the state develop a plan about how to encourage more districts to buy in. We did sustainability plans. So as you know, New Jersey just went through a gubernatorial transition. And so part of the work that we did was help the state team plan, legacy plan, identify key priorities, figure out what they wanted to really translate to the next administration. We established coordinating bodies and reviewed, helped state and territory teams. Well, no, there were no territories participating, but state teams review what they had in terms of coordination and develop youth councils, which I'll talk about now. So let's go to the next slide. This is just a quick overview of the work we did in the Policy Academy. Like I said, we wanted to support states without our own agenda. That's kind of like the NGA motto. We try to show up for governors and support their agenda versus trying to move our own forward. This is the timeline. These are some of the key metrics of what we hit. But I want to make sure I get to the next slide, which is why we're here today. We had a Youth Advisory Council. It was the first time that NGA has really ever done a Youth Advisory Council model. We have Braley on today to talk about it too, which I'm so excited. But the way we developed this is that we had heard from the jump of our work here is how important it was to incorporate youth voice into this work. And we really wanted to come up with a way that could blend the unique approach that NGA takes to policy engagement with this best practice that we had heard about. involving youth voice. And so we empowered and supported states to select youth advisors that worked alongside their state teams to develop these to accomplish their goals. And so what that really looked like was that youth advisors were attending the monthly TA meetings, they were attending the in-person convenings, they were hopping online to help us work through problems. And then we also had, curriculum and quarterly connection, where we pulled together the advisors from all the different states, also with SMEs to talk about career development or like an intro to the acronyms of the mental health space. And we culminated in last January, so I can't believe it's already been a year, with a final presentation with a number of the advisors represented here on this photo, where they shared their reflections about working in this way with the states and territories or the states that were involved, and being really under the hood with the folks there. So, like I said, it was the first time we really done this, which was kind of nerve-wracking as the person in charge of it. It was the first time not only we had paid youth advisors, which was really complicated. Like we had done an honorarium model before, but this is the first time that we were paying like with a substantial amount. And so as somebody that, was working with my finance team, everybody here, it was like a learn as we go for NGA. And it was also the first time that we wanted to kind of center the development of the youth advisors or youth working alongside us here in addition to the state teams as well. So it was definitely a unique model, a little bit of a vulnerability, but it ended up being one of our favorite parts about the work that we did on this policy academy. So I'll go to the next slide. We actually ended up coming out of this. We realized that some of the best takeaways we had from the Policy Academy itself was this idea of like, how do you actually work with youth advisors? How do you meaningfully engage them? How do you structure this? How do you overcome like the hesitancy that you might feel if you're an organization or a state agency that has never involved youth advisors? And we published a report, which is a governor's guide for incorporating youth voice into policymaking. And this report was fed directly from our experiences, but then also deeply from the voice of our youth advisors, as well as the state team leads that worked alongside them. Again, our goal is to make practical resources that can go on a governor's desk on day one and is decipherable and easy to read and understand and pick things out of. And so that's what this report became. It was just kind of like a policy recommendations of here's exactly what we think you could do or consider if you're, if you're stepping into this field. And so we did a framework for engagement, which was a view across states and territories, talking about the different ways that governors and agencies engage in the space, building engagement structures, operations, and compensation. Those are kind of the content categories in the report itself. So we're super excited. I've linked it there. I'm going to go into lessons learned in just a little bit. But before I do that, I want to go to the next slide. One of the things that I found really interesting about this work was this idea of like, why is this a challenge for governors? I think especially in this space, it can feel pretty straightforward to be like, well, you should include a youth voice. Like it is a best practice. Like we know that policy gets stronger when you kind of run it through and run it alongside and lead it and develop it with the people that are like benefiting from it. However, I mean, you all know this, there's a big gap between the ideal and the reality of where these things sit in states and territories. And so one of the things that we really had to grapple with that really does reflect the concerns that governors have or might have about this work. And I just want to give those a bit of airtime because I think that's really contextual for how this work moves forward. The first thing we see is competing priorities stretch staff bandwidth. One of the big recommendations we had for the report was like dedicate a staff member to doing this and finding somebody that has both the access to power to be influential, but then also the bandwidth to take on leading a youth counselor or really fostering that relationship is really challenging. In some states and territories, there might be one person working on this issue, and then having them come on and add an additional point onto their job, they're like everybody else. They're feeling burned out. They're feeling tired. And so I think, especially when there's, in a stable state, it's one thing, but then especially you layer on federal challenges, it's just really, really hard, I think, for governors, advisors to lock into sustainable or like kind of longer term models or high intensity work models when everything else kind of feels like everything else is on fire as well. Governor's offices are also very sensitive to liabilities. What is the liability if this fails? Like, what happens if this project doesn't work or it's a challenge or things like that? What is that a liability to me politically, reputationally? It is it's a folks are risk averse. And so I think that we see that as well when it comes to youth engagement. Advisors are really concerned about what happens if they misspeak or they misengage or they miss a meeting or something happens that it's not necessarily a huge success, which is, all of us that work in professional environments, we know that not every initiative is going to be a winner, because of sometimes people's bandwidth change. There's a personal emergency, things fall off, etc. And so I think there's a deep concern, especially when it comes to youth engagement, to really treat it with respect, but that's creating a really risk-averse system. Also, sustainability across transitions. As many of you know, we are looking down the barrel of like dozens of governor's elections this year. And so for those that are, anticipating leaving office, they're trying to cement legacy systems. And for those coming on, they might get their feet under them before they go into the youth engagement space. So I think that there's also this idea of like every 4 years, there might be some element of instability. And a hesitancy to do it halfway. People really want to make sure that they're doing this perfectly, which is really great and important. But the thing that I've learned about working alongside states and territories and government, nothing's done perfectly on the first try. And I think it requires this element of grace from both the youth advisors that we felt on the NGA side. We were so lucky for that. But then also from the advisors as well, to be willing to do it halfway, to start it up. I always say that in order for it to be reformed, it needs to exist. And so I think that that's, one of the things that we see kind of catching hold. So let's go to the next slide. So I think this is cut off slightly here, but we'll share the report and the slides after this. I'm just going to quickly talk through some lessons learned. We really tried to build this in like a very strategic, I use the phrase Sharky way, which is like my Jess Kirchner DC vernacular of talking about the very distinct strategy of these things. In terms of recruitment, we broke out the idea of having a consultant style versus a council. What's the power of having one youth really embedded versus many? We talked about the idea of not just tapping the interns and how many state advisors will just turn to the youth that's already locked into their office and say, "Hey, you want to do this?" And how that can just be a barrier to kind of recruit the same type of youth all the time. We talked about advertising professional development opportunities and compensation. And then, being diverse in your recruitment style. We know that the TikTok of it all can be complicated, but it's where youth are. In terms of compensation, we tried to offer a strategic recommendation based on our own experience of talking to finance first. Locking in compensation is like a core component, is so critical, but then also the operational step of doing that first was really important. Can we go back to the next one? I'm happy to go back to that. Perfect. Thank you so much. And then the other thing that we had mentioned, referred governors advisors to, is like in terms of determining rates. One of the big barriers that I think folks like MHA can help bridge the gap is helping state staff understand what is a fair rate, or like how do they actually come up with numbers that, in terms of compensation, that feel both achievable for a state or territory that's in likely a fiscal crisis, but then also that make youth advisors feel like they're bought in for their time. And that tends to be kind of a nebulous process for folks there. So leaning in and looking to partnerships is really helpful. And then the piece that we heard too is leveraging an intermediary. I'll just talk through these top three. We found that especially leveraging the folks that were in the field, like if we were to go to a governor's advisor today and say, "Hey, you're trying to pay your youth," my number one recommendation would be to go figure out who in your field has already established a paid youth council, and then, come up with a partnership with them to make it easy. Let's go. I think the lessons learned, I think I might be able to do this. Perfect. Okay. The next section, and I'll wrap here after this, was operations. It was, again, like I mentioned, the idea of finding a representative that sits between access to leadership, which we know is really critical, not only for the impact of the council, but to make youth advisors feel like they're actually talking to somebody who has power. But finding that person that also can staff a full-time council is a big challenge. And then one of the big things that we wanted to double down on is this idea of like anticipating and preparing for tension. I remember being in another organization's meeting, and a youth advisor there was like, we should make healthcare free. And I was sitting around a bunch of people that understand healthcare policy in the weeds, that understand all these policy things, that know the political dynamic in their states. And I was so frustrated that no adult in that room like took the time to say, great idea, but here's how this works, or to like provide them the feedback and information about the dynamic that everybody else was playing in. But instead it was just accepted as like, oh, that's great, fantastic, great idea. And there was given no weight or respect to that, to the suggestion the youth advisor had shared, but then also to the framework of reading them into the box that states and territories play in. Because I think that was really important work from our space. One of the things we wanted to do is that you learn really quickly in government that progress is usually incremental. It's usually not where you want to be, and it's usually challenging and hard fought and gets sidelined and then moves forward. And that can, like, when those expectations are not communicated to youth, or youth are not bought in and read in and feel like equal partners in that decision or in that framework, it can cause a lot of tension. And so, one thing we wanted to do with this report was to really prepare people and say it's normal. It's normal if you feel funky. It's normal if you don't love that. Maybe in certain situations, your youth council is mad about a decision that the governor's made. That's okay. That's normal. It's part of the process because I think, like I said, this tension leads to the risk aversion too. So I'll go and I want to wrap at this next slide to make sure we move forward. What's next? On this slide, I have two things that came out of this Policy Academy that we're very excited about. The first is the Youth Mental Health Strategic Plan from New Jersey, which was deeply informed by their youth advisors who are rock stars out of New Jersey. So I have linked that there. I would recommend everybody go and check that as well. And then I also want to highlight that Oklahoma has a youth council, a compensated youth council that I just found, and I texted Kelly. Braley is going to talk about this in a second. But they have established a fantastic youth council in Oklahoma. It's compensated. There's a ton of documentation. There are clear roles and responsibilities. They have a handbook that we help them develop. And we are just so excited to see that continue in their iteration. I heard from Kelly in Oklahoma that they got a ton of applications and a ton of interest and ended up expanding the number of youth on the council because there was just such a huge buy-in. So we're continuing this work and we're excited to see the impacts. So I think the next slide just has my contact info, and I'll wrap there. I'm a smidge over my time, so I'll turn it back to Alicia. Thank you all so much for having me. I'm so excited to highlight this work, but excited to turn it over to Braley, who is truly the expert on this, and the work that she did with the Oklahoma team is fantastic.
Yeah. Thank you so much, Jess. I really appreciate how much you packed in. So the couple of resources that Jess shared, we'll make sure that those are also included in the follow-up email we sent out in case you didn't catch them. So I'm going to invite Braley to join us, and I'm going to ask her a few questions. But before we start, like our kind of fireside chat, I'm going to ask her to give a brief overview of the project that she did when she was participating in the Policy Academy's Youth Advisory Council. Go ahead, Braley.
Hi guys, my name is Braley and I worked on the Oklahoma Youth Advisory Council. Essentially, I just really helped with like obviously making the manual and also providing expertise on what it's like to be a youth and the experiences that we have. Essentially, really focusing on the barriers that might get a youth to these rooms, especially when it comes to Oklahoma. I've talked about this a little bit before. It's a little bit more rural, and so that means that a lot of the times youth that want to advocate aren't able to. And so we talked a lot about providing gas cards, incentives, making sure that they had an online version and also one that they could do in person and spacing that out for young people. One of the things that we really talked about is also engagement and making sure that the youth that stayed in for like the first year could also have the opportunity to coach the people that came in like second year. And so there would be a more circular process for this versus a lot of times what I would see when I was a youth is like we would be a part of a program and then everyone would kind of leave at the same time. Like we would all graduate or we would all age out. And so then there wasn't really like a continuous cycle. It was like now we're back at like ground zero again because these young people have left and they all came together. And so we really tried to figure out a way that we could have at least, them be committed for 2 years and then the next cycle would come and they would be able to replace them. Yeah, and so that was essentially what we did. It was a really informative process because I was a youth, being young, but also like they had a lot of understanding of like policy and what was actually going to be implemented. So we, like just kind of said, I was able to grow a lot and like maybe kind of expand on that wishful thinking and maybe have a little bit more of a strategic plan. And so I feel like the manual was really helpful because I had also been a part of youth groups where there was like not a manual. It was kind of like we were all here. No one really knows like what direction we're going in. And we're all like meant to provide an idea or talk about maybe like a hard part of our life, but there wasn't a lot of like concrete things. And so we really wanted to provide that for young people because at the end of the day, young people want structure and maybe like structure that is guided. But like we want to have something we can look back on and know that what we're committing to. And so that's why the manual is really helpful, so that like a youth can refer back to this and see what they're committing to and make sure they want to commit to it because sometimes you get a part of a group and you're like, I didn't know this commitment was going to be this big, you know? Now, then people essentially fall off because it's too hard to um, make those commitments with school and other things. So, yeah, that was essentially what we did.
That's great. Thank you so much for that overview. And I love what you're bringing to our audience because I already heard at least one really actionable thing that people can do. This idea that when you have a cohort of young people, they come and disappear together. There's no one
Mhm.
holding the progress of the group down for the next group that comes in. So having like that model where there's always somebody who was there last year to inform the new participants. What a great concrete suggestion that people could actualize like tomorrow in their youth outreach and their youth work. So I want to think a little bit about how the work you did with the NGA impacted you as an advocate and as a professional. Um, did it influence you in education or career choices, like as a young person launching?
I think it was definitely helpful, like I said, because when we joined on with Jess and everyone, we would have like lessons over how to like actually implement a policy and what is like going into these things. I think Jess mentioned it before, is like a lot of young people, like when the young person was like, I want Medicaid to be free or I want health insurance to be free to everyone. Um, those are a lot of wishful thinking, right? Like we have these big dreams and like we don't want to crush anyone's big dreams, but we also want to provide like strategic ideas that follow that. Like, and I think as being a youth coordinator and like helping young people, it was like normally we would come and we would talk and they had these big dreams and I love the big dreams, but there wasn't really any strategy behind them. Like, so that's like a thing that I think was really helpful. Just like being a young person and coming into this group is like I was kind of figuring out what strategies to implement and how to like get to my goals in a way that was grounded and stable and not just like I want everything to be free. Wouldn't that be really nice? It was free. But it was just like I think that really helped. And I'm getting my master's in social work, so that is also a very meaningful work, as you know. And so I do think in some ways it made me want to do more like policy advocacy and get more on the macro side, if anyone's a social worker working in organizations, because I deeply understood what it was like to be a young person and experience those things so that I could hopefully influence more policy implementation.
Yeah, yeah, thank you. You know, thinking about your trajectory, how do you think young advocates can stay engaged as you age?
Mhm.
Like, how do you stay connected to your youthful experience and stay plugged into the challenges of being a youthful advocate? As you become like an adult advocate, how do you suggest that some of
Yeah.
our folks in the room stay plugged in?
I'm a little bit like biased because I work in a school, guys. So I spend a lot of time around young people, way more time than I've ever expected. So I work in a school, so I spend a lot of time. But with that, I do think that being mindful of like for me when I work with young people, it's like I treat all of my students as, people, but they are not adults. And so like making sure that I provide stuff that it's able for them to kind of understand where they're at and how to navigate that their experiences. And I kind of have this weird, I had a weird experience where I was like working with a young person and they were like, just like, oh, I'm super nervous and I'm just like, I don't know what to do. And I was thinking, oh my gosh, I'm in this kind of power imbalance, for once in my life where I'm the adult, right? And I'm not the youth advocate or the youth coordinator. And the thing about, making sure your hands on the pulse when you're adult or working in these fields is like power kind of feels like nothing. And you have to kind of remember that is like being an adult and realizing like, oh my gosh, I have power and I have influence and what I say matters, and not to put any pressure on anyone because that I don't, but like that's just something to keep in mind when you're working with young people is how much what you say and do matters to them, and like how you're navigating those things with them. Not always easy. I'm not saying this is easy work, but to be mindful. And I feel like I've had really good retention and being able to keep the people I serve, young people that I serve, engaged in my program is because I feel like I'm always mindful of those things that like power feels like nothing. I'm in this role and I have to remind myself that they might see me in a different way, even being a youth advocate and doing that work for so long. I think it's a good thing to remind yourself, not be too divorced from your young self. And remember how much pressure you put on yourself as a young person is very important as well. Hopefully I answered
Yeah.
your question in some form.
Beautifully. You answered it beautifully. This idea that power feels like nothing, right? Like if you're in a room and you don't know who the boss is in the room, like maybe it's you.
Hmm.
Um, and recognizing
Yeah.
recognizing that and giving room for other people in the room. Yeah, I really appreciate that like kind of mechanism of self-check that
Yeah.
power can feel like nothing. Wow. Before we move on, is there any other lessons learned that you think that our audience would find helpful? Um,
Um,
Anything that you could share with them about inspiring young people to do this work?
yeah,
I know something you said, like it's not fun, but it's important, is something you
mhm.
shared with me. So like, how do we inspire people to do this
Yeah.
work, young people?
And I think the purpose has to be bigger than maybe like that fast gratification. Like, what is your purpose? And like really, and I think that's what's like kind of important about the manuals and stuff, and that clearly put like this is the purpose and this is the long-term goal. But also incentivizing young people in between that with things that keep them going, right? Because like we want to focus not only on the big wins, but the small wins. And so what can we do at the end of the month that's a small win for our long-term goal that we have, whether it be like focusing on youth mental health, but what is something we can do in the next 2 months that's going to be really impactful for us? And I feel like that really helps young people stay engaged and stay focused on the purpose. Because if you're only like focusing on something that's like a year or even 7 months, it might be too much for them. But if you can make small wins by the end of the month, like, hey, by the end of the month, we're all going to have a party and we're all going to just congratulate ourselves for showing up to the meeting because that's hard. Like showing up is hard. You guys made it here all like each week, and that deserves a like something. And so I feel like that is a really good way to keep people engaged long term. And I know this is probably like, no one really cares how much you know until they know how much you care. And that's just like the philosophy I live. And I feel like for young people, that's going to be the most important. Like, does this youth coordinator do these adults in the room or whoever it is like really truly care about what I have to say? Because I think a lot of times I see like kind of in like kind of a venting without a direction. Like sometimes it will have youth get up there and talk about a really hard time in their life, especially when it comes to mental health. And we're not providing them the direction or purpose of why we're sharing this information. And that can be really reactive to a young person to over and over have to share those really hard moments in their life. And so I think also that's why like people don't want to stay. It's like I don't really want to like stay here and talk about these challenging things. So like what is like the end goal of that? If I'm gonna get up, and talk about my unfavorable moments or something that's really hard for me, I want to see something in my the at the finish line. So those are some things I've learned just being a young person and having to be asked to do those things, right? Like coming from that place, and then like what am I going to be comfortable asking a young person? I talked about it at our last conference is just like I try not to ask a youth to like outperform their circumstances. And that means like if a young person doesn't have access to internet, why am I asking them to get on a virtual call? Like if I'm asking a young person to travel this and not giving them a gas card, why would I do? So like really trying to meet a young person where they're at.
Yeah. Well, thank you so much for being here today and sharing your experience with the project and honestly just sharing your passion for this work. It feels really good to listen to you. And I'm going to suggest you make sure you take a look at the chat because
Yeah.
other people agree. Other people agree that what you've had to say is powerful. So
Yes,
thank
thank
you,
you
Braylee. I
guys. And I'll
appreciate you
leave
doing
my
that.
email and stuff below if anyone wants to reach out. But yeah, thank you for having me and for me sharing my insights.
Thank you. Thank you so much. I'm glad you'll share your email. Thanks, folks. So if there's any questions, please keep putting them in the chat. We can cycle back if we have time. And if not, I know our speakers will be paying attention to the chat if you have questions for them there. So our next presentation takes us right back to New York, and it's an example of the state's commitment to increasing access to services and integrating peers into the behavioral health workforce. So today we have Raquel Kolodny. She's the program director at Greater Mental Health of New York, and her areas of expertise include anxiety and mood disorders, person-centered counseling, multicultural counseling and awareness. And joining her is Ruth Ann Becker, Chief Program Officer, also at Greater Mental Health of New York. And she works to design services and supports that promote self-determination, recovery, and community inclusion among individuals diagnosed with mental health conditions and substance use disorders. So I'm going to ask you two to take it away.
Thank you.
Hi, I'm not sure why both of our names say Raquel. I'm Raquel. Um, I'm Raquel Kolodny, that's Ruth Ann Becker. Both of our Zooms say my name. So today we will be presenting on a program called Inset. I think Ruth Ann,
Can you hear me okay?
yeah.
Yes. Okay, perfect. Okay. Thank you so much. We're so excited to be here and to present today. This is a program that Raquel and I have been involved with in the beginning. Raquel, what you told me the other day, how many years we've been working on Inset. It
Technically since
started in
2018. 2018.
2018.
Mm-hmm.
Exactly.
Yep.
My God. This program was really developed because we were working with the Alliance for Recovery in New York State to come up with a program where we could offer an alternative to assisted outpatient treatment. And so that was our ask. Please develop a program that we would feel could really impact the lives of individuals that we were working with or trying to work with that had a focus on engagement because we wanted to target individuals who were folks that did not engage well with our other programs and that needed a different and unique way of outreaching them and inviting them into this process of working alongside of us to be able to live in the community that was respectful to the way that they wanted to live in the community, but also acknowledged that there were folks in our community that were worried about them. It could be a family member, it could be a neighbor, it could be, some of the local businesses who were aware of folks who felt these people are presenting in a way that where they need assistance, but it doesn't seem like anybody is really being able to work with them. So that's where it started from. I was also involved in my own personal struggle with my adolescent son who had mental health issues and very much wanted to do it his way and not my way, even though I present myself as an expert in the mental health field. I was just mom, and what did I know? And we really were struggling. And I kept offering up services and supports, and he kept saying no. And so here I was, not only hearing from my community and my state that there was a need for a program, but experiencing it in my own home. I was going on my own personal journey of how do you be a family member that supports without, coercing them into a program or a medication or something that they weren't interested in. And so even though I've been involved in the field for 40 years, walking with my son through this process and fully having that understanding that he was in charge of his own recovery and what it looked like and how it should be shaped, which of course I was espousing in my work, but may not have been living in my home. So I really felt the isolation that family members felt, and I understood the need for families to want someone else to step in and provide support. Um, so that was where a lot of the assisted outpatient treatment or AOT requests were coming from family members who were like, oh my goodness, they were doing so well in the hospital, and then they get out of the hospital, they stop taking their medications, and then, if they were made to take their medications or then then everything would be fine. And of course, we know, those of us in the field, but also those of us with family members that we love, that will only last as long as someone is, either, mandating this, because the minute that man, that they're no longer mandated, most people stop and go back to doing exactly what it was that they felt that was helpful to them. So we in our program and Insight wanted to find that balance, and we knew it was going to be extremely important that this was not only peer led and peer run. That we have the right staff, and we'll talk a little bit about that in a bit, what that looks like, because I'm sure many of you who are attending this conference have wonderful peer programs. We at Creator Mental Health have really fabulous peer programs, but it was time of all of us to sit down and look each other in the eye and say, this does not necessarily work for every person we're trying to work. So I'm going to hand it over to Raquel so she could talk a little bit more about the sort of the foundation of INSET and our belief and our sort of tenets. And then I hope we can open up for some conversation and discussion about some of the successes and things that we're seeing. So thank you.
Absolutely. Thank you, Ruthann. So I can go through these fairly quickly because Ruthann touched on a lot of it. Who we support, people at risk of involuntary treatment, people at risk of negative systems involvement, high utilizers of more intensive, expensive supports and things like that. We as a team, we're rapid, intensive, flexible, sustained, we're voluntary. As any peer program is, we're voluntary. We are persistent, but not coercive. We're never going to force somebody to be a part of our program, but we also really try to encourage people to meet with us because they are at risk of or potentially have mandated services where they are forced to meet with people. So we want to try to be in their corner in a way that is not forceful and that they feel comfortable with and that they have choice. Let's see. So the criteria, everything we talked about. Why might someone refuse support? So individuals may not agree they have a behavioral health condition. They might not agree anything's going on with them, that there's nothing wrong. Historically, maybe services have not addressed their immediate concerns. They feel misunderstood. They feel judged. A lot of the people we work with have had past negative experiences with the system, whatever system that is for them, which can often lead to a cycle of hospitalizations or incarcerations, sort of in and out, without their real, their true needs ever fully being met. It's often not a refusal of help, but a loss of trust. So we need to go in there from a peer perspective. The INSET team is a team of it's not a clinical program, but I am a licensed mental health counselor. I'm also a peer. So there is a little bit of clinical oversight based on need. peer support, care coordination, family support. We have a nurse practitioner who technically can, in the model, can prescribe medications. We haven't done that yet. She's more of a provides psychoed, helps connect to other resources. Uh, Sometimes having that medical professional, it helps a little bit to get us in the door places or get some of the information that we might need in order to support somebody. So we do work as a team approach, but it is completely, all peer-led, peer-based, no matter what. Oh, shoot, sorry, my screen. So our primary focus is on engagement. That is the most important thing right off the bat. We have the way the model works is we have this like outreach or pre-enrollment or pending phase, and then we have our enrolled phase. The pending piece of it is somebody's referred to us, or we meet somebody in the community, or we get somebody's name or whatever, and we're just going out to try to get to know the person, to meet with them, to engage, to build rapport, to see if there's any immediate needs that they might have that we could support them with without saying, okay, we are now going to, you have to fill out this paperwork and you have to be a part of the program. There are a lot of programs where if you don't fill out paperwork, you don't agree to meet, they're not going to continue to meet with you. They're not going to continue to show up because you have declined the services. So while, of course, like I said, we don't force anybody to do anything, we are going to keep showing up and to keep letting them know that we are here. We do want to help, however that looks. Somebody might be in pre-engagement for a week. Somebody could be for 3 months. It really is completely dependent on the person and their situation. So that ability to have that really long engagement rapport building process has really helped us to see a lot of success with the individuals that we work with. INSET allows for more frequent and flexible contact while intentionally slowing down engagement so individuals never feel rushed. And that's the biggest thing. We don't want people to feel rushed. We don't want people to feel like we are just somebody else that's coming in to say we're going to do all of these things for them, and then we never actually support them in what it is that they're working toward. We have no set agenda, so support, what that looks like is totally dependent on the individual. We do address basic needs, food, shelter, clothing. We help with the care coordination, benefits, systems navigating, all of that. Yeah. So peers, big piece of this, right? Peers are central to everything that we do. Peer support helps to build trust with the individuals who distrust the system, recognize barriers participants may face, connect through shared understanding, model recovery and resilience. Just having navigated the systems that many of these individuals are navigating, they might have tips and tricks and ways to sort of get into places that the individual has been trying to get into or doesn't even know, they might not even know that certain supports are available. So us as peers and truly the peers on our team are huge when it comes to just connecting, building trust. Oftentimes just hearing like, oh, you're not a part of my AOT team, or you're not a part of this, or like you're separate from that, has really helped to build that trust. So while we are a part of Greater Mental Health of New York, we are a part of a larger agency, we have we make sure that we are very distinct and separate from the rest of the program. So if we're working with somebody, for example, who is part of housing, right? Housing has their own rules, their own expectations, things like that. We are not going there and pushing housing's agenda, right? We are just meeting with the person, seeing what we can do, hopefully support them if they are having issues in their residence or wherever it is. But we're not going there saying, we are here from Greater Mental Health of New York's housing. Oftentimes the peer becomes the person that the individual feels most comfortable reaching out to. So we've had situations where other providers, therapists, whoever, parents, family have been trying to reach out to an individual and they have had no luck. We could say, oh, they've been in contact with us. So everything we spoke about. One of the things is creating an intentionally supportive workplace for peers. So as an agency, and Ruth Ann can speak to this as well, but as an agency, we really make sure that we are peer focused, we are, trauma informed, we value lived experience across the entire agency. We have many people in directors and higher up positions that identify as having lived experience. To make that a normal thing, right, amongst everybody. We have supervision, both weekly and in weekly individual supervisions and also cross-agency peer supervision. So all of the peers across the agency of all the different programs get together, talk about what's going on, have that space for one another where it's run, facilitated by peers as well. So it's not, it's definitely a safe place. Peers are given autonomy, encouraged to use their judgment in the field. We are not constantly overseeing everything that they're doing, thinking of it as they need constant supervision because that's just not the case. I mean, especially with the INSET program, the peers are the one going out and doing everything. So I turn to them as the team leader. I'm turning to them for questions and finding out what's going on. And it wouldn't work if I was micromanaging everything that they were doing or treating it as like the nurse practitioner is more knowledgeable or has more say or more senior because she has that medical degree. I'm going to go through this quickly. There are two.
Well, I just
Yeah.
want to interrupt for 1 second before we go
Mhm.
to the scenarios here. One of the things that's very interesting about overseeing INSET for as many years as we've been involved in this is the understanding that this program is not for every peer. Not every peer that comes into our agency is a good fit for INSET, and a lot of that comes from, as Raquel mentioned, we're persistent, and that's like the biggest sort of expectation of the peer staff is that you're going to keep going back. You're going to, and this is a very, very challenging concept for some of our peers because, as Raquel again highlighted, the programs are voluntary. And so how can you be persistent and someone saying, no, I'm not interested. I'm not interested. And you keep going back and they're like, but this is supposed to be voluntary. Um, so uh, how do we bridge that gap, right? And so we discuss this in the interview process, where we make people aware that if you're not comfortable with this notion, which we understand, I mean, it's even in the ethics of the New York State peer certification that that folks will not be coerced or that they have a right to say no. So if you're not comfortable, this is not the right program, and we probably have another peer program that is a better fit for you. So this really is the hiring is integral to the success of this program, because you really want to ensure that as a team leader, when you're saying, okay, can you go back out and knock on that door or go to that space where we know where they are, that they're not going to say, this is feeling uncomfortable to me, that I feel like I'm imposing myself on them. The reason why we are the reason why we keep thinking about this is like this notion of we never know when people are going to say, yes, I'm open to your help. And so if we keep showing up in a very non-confrontational way, saying we're still thinking about you, we still think we have a resource that might be able to help you, and that who knows, it might be the 100th time, but and what's the harm in just, going by and saying hello? So I just wanted to highlight that as being a very important part of this.
Hmm. Yeah, one of in line with that, what I had written as sort of like a closing is at the core of the work, it's not just about services, it's about having the right relationship at the right time, and you never know when that time is going to be. So continuing to show up, like Ruth Ann said, knocking on the door, going to their where they frequent, whatever it is. Unless somebody truly is very insistent on leave me alone, I do not want to see you again. Of course, we'll respect that. But if there's, we feel like there's any inkling of possibility, and rapport, we're going to keep trying. I know we do not have much time, so I won't really go into the stories. There were just two situations, two examples. One of an individual who sort of had a basic normal trajectory, if you will, of what her success looked like with INSET. She was discharged from the hospital, had a lot of things going on, ended up having to be rehospitalized. We worked with her. We supported her through all of that. She had a lot of stressors and whatnot. Through our work with her for well over a year, she connected with services that she felt comfortable with. She reconnected with her sister and her family, and it was a really wonderful outcome. She had a lot of difficulty engaging at first, right? So we kept going and going, 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 and that's sort of this more traditional, I guess, what success might look like. Another individual that we work with, it's a little bit different. So she has had a much more, has experienced a lot of trauma. She has a very difficult time with transition. So having, being a part of the system that she's in, she's often experiencing transition with care providers, with things like that, which has been very challenging for her. Historically, she has cycled in and out of the hospital, sometimes just using the hospital as a form of respite when things became overwhelming. So she was a very high utilizer of these expensive services or pricey services. With the support of INSET, those hospitalizations have decreased significantly. What really made the difference is the consistency in the relationship. We have the ability to check in with her on a regular basis. She can call us for 5 minutes to just say, hey, I'm doing okay, or hey, this is going on. She doesn't have to worry about having a specific time schedule to meet with us or whatever. If somebody were to just look at her chart, they might think, oh, she's doing well. She's not hospitalized, she's stable. She can be discharged, but really for her, the stability is what's actually keeping her well. So we are going to continue to work with her and we're going to keep her in the program because it's working for her. That's it.
Thank you both so much. I really appreciate you sharing the values of your program because it's values that Mental Health America share and it's values that the folks on this call share. And we wouldn't talk about self-determination so much if it were easy, right? We talk about it because it's so challenging within our families, within our employees, and within the people we provide services for. And I'm just thrilled to hear how much latitude your employees get to make judgment calls about the relationships that they're building. Thank you so much for bringing this to us today. If anyone has any questions, please put them in the chat because I know that Ruth Ann and Raquel will answer there. Thank you. So I am going to move us along because, friends, I am thrilled that we are right on time today. So thank you all so much. We're going to bring Glenn Libman back into the spotlight. As you recall, he is the CEO of Mental Health Association in New York State. We refer to them as Mahaney's. And Mahaney's was designated as a best place to work for small companies by the Albany Business Review last year. And Glenn's going to share a little bit about how they got there. Go ahead, Glenn.
Great. Thanks, Alicia. Appreciate it very much. First of all, I just want to, it's a pleasure to follow INSET. Ruth Ann and Raquel do great work. INSET's such an incredibly innovative program that, we were there at the beginning, the Alliance, we worked very closely with the Alliance, and it's just great to see the fruits of their labor, and couldn't ask for greater partners than Greater New York. So anyway, so let me start off by talking about two quotes that I often reference, and I'm not doing a PowerPoint, I'm just kind of doing it old school, which I'm old, so it makes sense it's old school. Two quotes. First of all, I was an old sports writer, so these are both sports quotes. One is by a football coach who no one's ever heard of before, but it's basically said, "It is amazing what you can accomplish when you don't care who gets the credit." That's the first quote. The second quote is by another football coach, more famous one, named Bear Bryant, who said, "I don't hire anybody not brighter than I am. If they're not brighter than I am, I don't need them." And those kind of quotes kind of really guide my management style. You always give credit to your team. The number one thing we do is we constantly, and a lot of you already do this, a lot of you are already very familiar with it, but we always make sure to give credit to our team. And the other thing is we also hired a very skilled workforce. It's not rocket science, and yet I'm amazed at all my years of management in many different capacities that there are many leaders who don't understand these very simple concepts. And they're the core values of what you do. You basically make sure you have people who are very talented, and you make sure to let them thrive within their environment. In the 22 years I've been in Mahaney's, we've grown from a $850,000 organization to next year will be over $10 million organization. We've gone from 7 staff to I don't even know how many we have now. Our space has almost tripled. And why did this happen? A lot of reasons, of course. There was serendipity involved. You just heard earlier today, I gave the award to the governor for all the work she's done in New York. And obviously the fruits of that labor has also come, we've gotten part of that as well. But there are two things that have nothing to do with that. And that's professionalism in our work. They're really homegrown. Everything we do, there's a professional piece to this. Everybody is professional in our work environment. And we have a really strong workforce led by our COO, Melissa Ramirez, who's been with Mahaney's for almost as long as I have. It's interesting. I was trying to think of this analogy today or the other day, and I was thinking, when you're a waiter or something, like, it's not my table. At Mahaney's, it's everybody's table. Everybody does everything. There's nobody who stands on ego. There's no one who stands on any kind of like, oh, I'm too important for this or not important. It's too important for you. That's not who we are. These two go hand in hand. You can't have professionalism without a good workforce. What I am most impressed with is that we all know the struggles of not-for-profits. We all know them very well. We all deal with them all the time, everybody in this room. But we've been able to support our workforce, and we measure that call by the fact that longevity. We have a workforce within Mahaney's that have been with us for many, many years, several people. And I look at our friends in the New Jersey MHA, and I know the same thing. I know with the Barb and Carolyn and those folks, they've been able to maintain a workforce for a really long time. And I think that really talks volumes about the environment of where you work. So we created a mnemonic to sort of describe kind of our philosophy around the workforce, and we call it RELIEF. The R stands for respect. You have to respect each individual in your workplace, whether you're the CEO or a new staff person. You have to create a culture where everybody supports each other. The E stands for effective communications. As we have grown, this is an issue we struggle with. I come from state government where we should have meetings. We literally have meetings about meetings about meetings. I'm not even joking. I'm generally not an anti-meeting person, but I've got to say I've learned that to do it surgically is incredibly important. You don't want to sit there and say, okay, let's meet about this, let's meet about that. Talk about it surgically, define the meetings that you want to have, and make sure you have an agenda for those meetings. We have a biweekly staff meeting and a weekly meeting of our executive team. I love these meetings because our folks are very smart and they often have great ideas. At the staff meeting, everyone goes around in the room talking about their week of work and the week ahead. But what I also love is they also focus so much on what they're doing on the weekend. It's not just about 100% work every second of the day. We do talk about other things as well. And we really try to emphasize that at the staff meetings. It's all positives, and there are a lot of affirmations. We really, again, nothing is perfect by any means, but we really try to keep things very positive and and as loose as possible. We take our work seriously, but we don't take ourselves seriously. The L in the relief is life skills training. We've been lucky to retain quality staff, as I mentioned. The sad reality is that when you live in Albany, New York, the number one business in Albany, New York is state government. State government can afford things that we can't. State government has a greater benefit package. State government has higher salaries. So we have to be really innovative to keep young people or all people. You have to figure out ways to do that. And we try to do that by recognizing that not all of folks are going to be with us for any kind of really long time. So what we do is we really try, to invest in these folks and recognize that they're future leaders. Wherever they're going to go, we hope that they kind of use us as kind of their springboard for success in their community. And that's happened. The advantage of being here for many years is I've seen many people who've come from our agency who are now in state leadership positions and in other nonprofit leadership positions, because you're able to give them some sort of ability to okay, I can get these skills. These skills are available to me. These trainings are all available to me. We start the idea of linking community colleges into people who want to have careers and get the information from community colleges. So that's the L. The I is for insurance coverage. Again, we're not state government. We can't duplicate benefits. However, what we do offer is very competitive insurance for individuals. We underwrite the full cost of individual health insurance, and we discount family insurance. We provide life insurance comparable to a year's salary, and our board of directors has provided a 403(b) match. It's generous, but in this environment, again, where sort of pensions are becoming sort of a thing of the past, in Albany, in New York, they're not. And we have to realize that, and we have to recognize that, and we have to sort of figure out ways to be competitive to those who are offering those kinds of pensions. The E in relief finally is for empathetic leadership. Of everything, I've got to say, honestly, this is the hardest concept for me. I grew up with a father who was a driven workaholic. He never missed work, broken leg, 112 fever. He didn't care. He was at work. So even though he's passed away over 20 years ago, his voice is still in my head about never missing work. But through life's circumstances, I've evolved through my own personal life story, through the pandemic. We've had to evolve, and I understand the work-life balance. I really, truly do. We have a work schedule where people have to be in several days a week, but unless they have an important meeting or training, they can flex a day. If they're working from home on Monday, supposed to be in on Tuesday, they can flex those 2 days. We want to make sure we have a springboard for success, and that's really hearing what our staff has to say. Our supervisors address that. We have supervisors, well, everybody's strength-based here, but our supervisors really address it very well. We trust our team members. We trust them. We trust if they're working, if they're home, they're working. We do. We hire really quality people, so we trust them, and we try to lead with empathy and not micromanage them. Finally, the F is for far-reaching. We want our teams to know the impact of the work they're doing every day. Like all of you in the nonprofit sector in mental health, all folks are doing great work every day, and sometimes you don't see it. My son's a direct care worker, so in substance use. So we often get some immediate feedback for the work he does. Our work is advocacy and training, so we don't have that immediate response. So we take a far-reaching approach that looks at how our system has changed over the years because of the work we do in mental health education, in schools, everything that the governor mentioned, and I mentioned in the introduction, mental health literacy, anti-stigma efforts, prevention, etc. Every person on our team should, and I truly mean this, should feel valued in their work they do. And if they don't, then frankly, I'm not doing my job, because they should really feel value in what they're doing every day, because we are making a huge difference. Every one of us in this room, everyone who's participating, makes a huge difference every day. There are a lot of other things that are important, and I know my time is almost over, but one thing is we never take ourselves seriously. We take our work seriously, but not us. A sense of humor, and an incredibly important part of this is a supportive board. We wouldn't be where we are. We wouldn't have grown and expanded the way we have if we didn't have an incredibly supportive board of directors who is just there for us every step of the way. They are I've been on boards, I've served on boards, I've worked for other boards, and this one is just they totally understand us and they completely support us and they don't micromanage or anything like that. So we're very lucky there. Um, and we also have affiliates that make us feel proud. Like we just heard from our Greater New York affiliate, they make us feel proud to do the work we're doing. It really is. It's an expression of everything we're doing in New York, and it really matters. And then the last thing I do want to say, and I don't want to end on a kind of a sour note, but I think it's really important. Um, you have to, and this is a tough skill, but if you're not a good leader, then this is very tough. Um, there are people, even though you hire a lot of people over the course of time, there are people who just don't work out. And I've evolved that to the point where rather than hoping to try to, save someone's position for the sake of them because they're a nice person or whatever, you can't do that. Well, our mission is way too important. And unfortunately, there are times, we do this in a very compassionate way. We make sure that, that we do a plan of care for people if they're having some concerns or some issues. But, there are times you have to let people go, sadly. And that's a fact of work. And those decisions are incredibly impactful. And, people say all kinds of things, do all kinds of things in those situations. But that's the reality of the work you do. Sometimes you have to do that. And I think that if you want to be a true leader, I think those are the kinds of things you just have to make those kinds of decisions, as difficult as they are. And finally, the reason, it is, as you said, Alicia, the reason we received this award was because it was which was really, that was so affirming to me, was that this was from our staff. Our staff had to fill out surveys, and they were asked anonymous surveys and asked all kinds of questions about, what's your work environment like, et cetera, et cetera. And the responses came anonymously, so we have no idea who said what, but responses came back anonymously. And we're very proud that we were the only nonprofit human service sector that was recognized for this award. So again, it's not me, it's a team, and I'm very honored to work with such a great team. So go team.
Go team. Glenn, thank you so much for that overview. I really like your acronym because, of course, we all like acronyms around here. And I also really just want to note your self-awareness, your willingness to learn and evolve as a leader, knowing that you set the tone and recognizing that you have to unpack some of your stuff to be able to make wise decisions. Not all leaders are aware of that. So I want to give you kudos for that. So thank you so much for joining us and giving us that overview. I want to
Thank
stay
you.
on this topic because Mental Health America has a program that evaluates and supports employers who are committed to creating mentally healthy workplaces called the Bell Seal. So I would like to invite Shanna Mulvihill, the Executive Director and CEO of Mental Health Minnesota, and Ben Harrington, who's the CEO of the Mental Health Association of East Tennessee, because both organizations have been granted the Bell Seal, and I'd like them to share those experiences also being workplaces that deserve recognition. Shanna, would you like to start us off?
Sure. Thank you, Alicia. Appreciate that. Um, I'm Shanna Mulvihill, Executive Director and CEO of Mental Health Minnesota. Just want to talk just for a couple of minutes a little bit about going through the process of the Bell Seal and why we think it's valuable and some things that we've really done in part as a result of it. So I think first going through the process itself, I just found really valuable because it helped me as an organizational leader to really do a much clearer and thoughtful evaluation of what we were doing as an organization to create a really mentally healthy workplace. And also really think about what else we could be doing. So it kind of forced me to ask the questions within my own organization and really take kind of a more thoughtful approach other than just, well, we think we are, right? It was really a very structured process to really assess and really think about what's next. What else could we be doing? I think it's been particularly valuable for us because when I go out and talk with employers about mental health and what it means to create a mentally healthy workplace, I can point to the Bell Seal, our own, as demonstration of our own organization's success in doing this. as well as, our level of expertise in being able to help them create that as well. And that being said, our organization is not one that has hundreds of employees and millions and millions and millions of dollars either. So I want to point out that we first attained platinum status at a place where we had a budget less than $1 million, and we were in a very different, I mean, we're in a different place now, but it's possible for smaller organizations to do things in creative ways to really create a really successful and great atmosphere for their employees. Just as a final example, we're always reevaluating the ways that we can support our employees' mental health overall. And in 2026, we added mental health days to our PTO benefit package. That came up in part because especially in 2025, we were really seeing more and more of our earned sick and safe time being noted as I needed a mental health day. And so wanted to kind of call that out and make it a little bit easier for our staff to take that time when they needed it without needing to feel like they needed to call in sick. So all of our staff get one mental health day per quarter, and they can use that in any way they want. They use it like they would a sick day, but they don't have to just stay home and stay on the couch and like kind of hide out. If they want to go for a hike, if they want to go run errands, whatever they want or need to do to be able to take care of themselves and kind of reset, they can do that without being afraid that what if my coworker sees me at the park and, when I really just needed to take a breath and take a beat, because these are stressful jobs that they're doing, in our call center, in our peer support lines, in our 988 center. And so really wanted to just create a culture, again, where we are just saying out loud, it's okay to take care of yourselves. So with that, would love to hand it off to Ben.
Great. Well, I would echo Shanna in a big way. Some of what I've learned from Shanna. So, it's really important to consider the Bell Seal opportunity. I found the application was fairly easy, and I think the Bell Seal recognition really provides street cred. If the organization is going to communicate with employers about what are appropriate supports for employees in the workplace, it is distinctly credibility that is the biggest value, I think. The other thing that's also important is its validation for a organization that's really trying to determine its culture, and are we really telling our employees who struggle with mental health issues, are we telling them they're valued? And so it's important that we're able to use the application process to really consider how we are thinking about our employees and trying to support them to lead healthy lives and really work on their mental health too. And so those are really important. So we also have mental health days, like Shanna. We've actually we started with 4 and we've increased it to 5 mental health days, and we plan them to be pre-scheduled throughout the year so that an employee gets their mental health day bookended with, a holiday weekend or something like that, so that gives that person a little bit extra time to have some downtime or the opportunity to reboot, or if someone wants to take that quick trip down to Florida over one of those weekends, then they can do so. So it gives them a little bit more extra time to do it. The other thing that we found in communicating with the team and surveying the team was so many of our employees were engaged in mental health services, which is what you expect from our organizations. But so many were engaged, and it's awkward to have to use sick leave all the time to go to therapy. that sort of thing. So we actually decided to create an additional benefit beyond annual leave and sick leave. And that benefit is called mental health therapy time. So if you need to take an hour a week for therapy, that gets booked as compensated work time. It's not charged against your sick leave availability. So that way, anyone using mental health services is not disproportionately eating up all their sick leave time because they go see a therapist once a week. So that's really important for us. Yeah, but so found it easy, street cred, validation, we're doing the right things.
Thank you so much, Ben. And just for a plug, for our affiliates being evaluated to be considered to get the Bell Seal designation, for our affiliates, that's free. So you can have something to brag about. In our chat, we've got Susie Craig, who does lead that initiative for Mental Health America, offering some resources because this opportunity is not only for affiliates, it's for other mental health organizations and other corporate organizations, really elevating this work. So, friends, we're coming to the end of our presentation, but I just want to share that for those of you who don't know, both Ben and Shanna are Regional Policy Council leaders who support other Mental Health America affiliate CEOs and leaders to collaborate and inspire each other to not only provide top-notch services, but also to engage in policy advocacy and make systems changed. They're joined in this work by Barb Johnston, who's the director of policy and advocacy for the Mental Health Association in New Jersey. So in our brief time we have left, I'm going to invite the three of them to offer insight from the states. Barb, could you start us off?
Sure. Top of mind for the states that we work with, of course, are the changes coming off of HR 1. So, I just want everybody to tune into that and know that the people we serve, there's a fair amount of anxiety around that. And I'm sure everyone on this call knows. What can we do about it is the question. And I think for the next 2 minutes, I'd like to tell you what we're doing. So one of them, I think, is to be completely sensitive to the concerns of individuals that they will lose their services for SNAP and for Medicaid. And, we want to make sure that we don't get ahead of ourselves with this and that we really are just trying to go stepwise and help support people and let people know that they have our support. So the first thing we're telling them is open your mail and read it and let us help you to decipher what needs to be done, helping people prepare any documentation they need. Very concrete. Out of crisis comes opportunity. Many of our states have joined in with other types of organizations who also serve people who will be impacted. And we're all working together very hard to make sure that we're not fragmented in telling people how we're supporting them through this effort. Additionally, we've all really been working much more closely with our administrations in partnership where they've had to add systems, where they're going to be closely monitoring, and they're using us in a very constructive way. So I would say that we're all coming together on this. We all are really working very hard to assure that every single person retains their eligibility for the benefits they deserve. So there's a lot of concrete details that we'll be able to roll out with you in the future. But, I think we're really looking at it as a way to say, we're all in this together and we're supporting everyone to retain their benefits.
Thank you, Barb. Shanna, do you have thoughts from your cluster?
I do. Thanks, Alicia. And mine kind of hop right off on where Barb left off. And that's, again, the implementation of Medicaid work requirements has really risen up as a primary issue for many states in the area I cover, which is mostly Midwest and West. And a couple of primary issues around that more specifically is one, ensuring that the state legislation that's being put in place addresses those federal requirements without enacting stricter compliance standards than are required by federal law. So there are states that are looking at adding even additional requirements beyond what federal law requires. And so those are things that we're paying attention to let's not make it even harder for folks to demonstrate eligibility for Medicaid. We also want to, we're really working to ensure that that exemption that's available for folks that are living with those disabling mental health or substance use conditions, that those can be demonstrated in a variety of ways rather than simply through an established diagnosis. That can be challenging for folks, especially those who may be seeking Medicaid coverage because they haven't been able to afford to see a provider and or maybe have not been able to see someone for some time to get access to assessment or treatment or services. And so being able to provide opportunity to demonstrate those concerns in as many ways as makes sense would certainly be a priority as well. I think finally, certainly the related to Medicaid is the issue and topic of fraud, because that is a conversation that seems to go hand in hand as well and is being talked about in a lot of states too. And so would just note that I think another priority is simply making sure that we're, as we address these issues in the states, that we're taking a measured approach to that and a balanced approach to make sure that that we're ensuring compliance, that we're addressing concerns about fraud. None of us want fraud to be happening in these programs. Of course we don't. But we also don't want to create so many barriers for providers that the folks they serve no longer have access to the services. Because so many of those services are things that are delivered in homes and in communities or provide opportunities for people to live more independently. And if those things start to go away or get restricted, we know the dominoes that result from that is folks end up in more intensive services than are appropriate or good for them, or end up in crisis or emergency situations. And so those are just some of the things that are really top of mind for us.
Thank you, Shanna. That's a lot. Ben, what are your thoughts? What's happening in your
Well,
cluster?
let's see, 1.5 minutes. Okay. So really tight budget years is kind of the theme that everyone is concerned about. But when you have conversations about tight budgets, then you automatically kind of wonder, how are things really financed in a state? And it's really across the board in the southern and southeastern region of the country, ranging from Florida, which is a property tax state. So the affiliates there are concerned about the fight in the legislature about, are they going to raise the property tax, a penny or something like that. And other states are financed by income tax, and some states by sales tax. So it's challenging in every one of those states, and it's probably going to get a little bit tighter next year too, just the way some of the things with the economic fortunes are, I believe. So those are some things. But I can tell folks, I can brag a little bit. In an income tax state like Tennessee, there are revenues that are made available for new programs and services, and so they are doing some things. And so on the mental health side right now, we're trying to leverage some inpatient hospital money for a new facility here in Knoxville, which would be really good. We need it desperately, but the conversation is going well, and a lot of folks seem to be trying to get that done behind the budget is the process. So that's nice. The thing that's really scary in the South is there are conversations about citizenship tests for services funded through a variety of state governmental agencies. And frankly, we don't know how that would take shape and look like in our arena. So how's that going to work for a 988 call center? How's that going to work for providing mental health screenings? How's that going to work for educational programs in the community or in schools? So that's got some area of concern for us that we have to work through and try to figure out, is that really going to happen, or what do we do to speak up to try to forestall some of that affecting social service agencies like ours.
Thank you, Ben. That's challenging, but it's an important thing for us to be paying attention to. Thank you.
Yep.
Thank you all so much for attending today. I really appreciate the folks who came to hear the wisdom, and I am incredibly thankful to our speakers who came and offered such valuable content. One more shout out to the Regional Policy Council funders. That's AbbVie, AtaiBeckley, Bazooki Group, Bristol Myers Squibb, Compass, Definium, Johnson & Johnson, Neurocrine, Otsuka, Pfizer, Supernus, and Teva. We are lucky to have you, and I'm so grateful that we have funding to do this remarkable work, and we have an audience to share this remarkable information with. Thank you all so much, and we'll see you next time. Take care.
Great job, Alicia.
Thank you, Ben. Appreciate you.